Shaileshanandji, you being a professional doctor, and I believe definitely you would have come across situations where
do we want
you're
to,
not.
Deepakanandji, want to Lalitaben first, or?
Yeah, better. Then we'll take. Then doctor will share his experience.
So why don't we take Lalitaben first?
Okay. Dr. Lalita Ben.
Jai Sachidanand.
Jai Sachidanand. So, okay, please go ahead.
No, first introduce the topic, Deepakanandji.
Okay, Jai Sachidanand. Lalita Ben and Dr. Shaileshanandji, we have now gone further to Maan, that is pride. How our pride gets hurt, and in our dealing with others, how we hurt other people's pride. And we have seen that Mahatma have shared their experience, and it has really thrown a wonderful light on pride. Not only that, how you resolve and what Dada has, or how Dada has guided us overcome that pride. That is how to do Pratikraman, and it doesn't show up again, or if it shows up, then you know how to handle that. So, Lalita Ben, and this is going to go on for 2 weeks. So this is the first weekend. Oh no, I believe this is now one Sunday. So the first week is ending. So here, we would like you to share your experience as being a professional doctor, medical doctor. You would have definitely come across situations where your pride gets hurt, and maybe sometimes even other people's pride get hurt by you. So can you please share your experience in that regards?
I will.
Please.
Before Dada, my personality was very confrontational. And Radhibai always said I did not have Syadvad Vani. I thought I was calling a spade and would defend myself. And he kept telling me that's not the way to do it. But that was before Dada. After Dada, his grace descended on me. My confrontational personality changed without any personal effort from me. And, you know, some examples, like when you have a clinical case and you know you're right and the other person is wrong, to insist on your viewpoint was, Dada's teaching not to insist on your viewpoint. And I would back off. And the personality change that occurred in me was, I decided that to be non-threatening to my colleague. And so, I remember like during residency, you'd have difficult case section, and I would say, I'd call the case for a section, and the fellow resident would go on and on, let the patient labor, just things like that, and afterwards we would have a confrontation about it. But after meeting Dada, that kind of confrontational approach from me changed. And Syadvad Vani, I'm still working on it. I don't have it, and I don't know how many people I have hurt. Those I've consciously hurt, I've tried to do Pratikraman for. And most of them are family members. So it's not necessarily professional, it's just, a personal. But some of the things that Dada has transformed in me is to become non-threatening to my colleagues. There are times that I still have had conflicts, but nothing that could not be resolved. That's what I want to say.
Okay, but when you said you consciously hurt your family members at times. So how would you do that? I don't know.
It's because my prakriti was like that. I had to have the last word. And whether they were right or wrong, I had to finish off this argument.
Yeah,
And I
yeah.
know that they were not happy with that. You know, that was my prakriti. It's a work in progress. It's the change is subtle, but people have come and told me you have changed after you met Dada. And I don't think I made a personal effort. It's Dada's grace.
That's the case with everyone. Actually speaking, it has just happened. So the darkness just went away because of the light of knowledge light, what that
Yes,
opened by His grace within us. And
I mean, I'm a direct recipient of his grace. And that's the surgery he did on me, let alone my surgeries on people.
how about instances where others had hurt your pride?
It's more on like a professional setting, on a clinical thing when I was right. You know, they would, what should I say, roll over my objections and do it their way kind of stuff. But I had to just swallow that because, you know, they weren't taking care of the patient, and you have to have one chief and the rest Indians. You can't have 10 chiefs calling the shots.
Just repeat this. Who?
You have to have one leader and the rest following. You can't
Chief.
have 10 leaders.
Okay, chief, you said.
Chief, you know, like American.
No, I got it. When you said leader, I got it. I didn't really get it. I said, wow.
Yeah, it's a saying here. You have one chief and the rest are Indians. Matlab, native Indians.
Red Indians, you want to say.
We don't call them red Indians. They call native Indians.
A better way to say. Eh?
Uh-huh.
Shaileshanandji?
Yes.
Please.
So,
Yeah.
though with a Jnana in inner bliss, I am Shuddhatma, but the discharge pride is still there. I started seeing that in my initial Samayik prayogs, and I could see that I am Shailesh is still not gone. The discharge name and name, the effects of whatever comes on the name. Somebody says you did not do good. No, I did not like your thing, then it gets affected. That's the subtle pride which I could see. Then I could see that whenever the people behave nicely and sort of thing, then that discharge pride or discharge ego, whatever you say, gets little satisfied. Oh, it's good. These are good people. But whenever the people doesn't recognize it, in Gujarati we say, or in English, he doesn't understand me or my level of understanding, then there is no reaction. But inside there is little unhappiness of that part or that pride part. So we'll keep away or we'll let them live their way, something. But that is a subtle pride which is seen when it gets boost or when it gets not directly hurt. I'm not so fortunate that the people come and hurt me, but at least I have seen that whenever they do not understand or sort of at that level, the discharge pride does come into play or is seen there. Similarly, one of my staff is a good person, but he's a different personality. Whatever he understands, he says, sir, why don't you do this? You do this. So he tells me twice or thrice. Mostly I won't retaliate or will take it, but sometimes I say, listen to me. I am also have some understanding. So then I see that I am boss or you are boss. I don't express, but inside that comes up. That and especially when, as Lalita ji said, when the relative self Prakriti feels that my understanding is correct and he is not understanding is all right. But despite not or less understanding, he's still showing power or overpowering or trying to trust, why are you not doing? So at that time, I can see that discharge pride of Shailesh. To be very honestly, I can see that discharge pride in sons also, because with Aptaputras also, with other people, most of them are good and nice most of the times, but not necessarily that. So I just keep on observing that, and it's good that I can sit in Shuddhatma and my Prakriti is also fine, left all alone, but at least I can see that and there, that the people having less understanding from Shailesh's framework are shining more and putting me aside, or it's so something like that, not exactly, but these are the occasions when I can see the discharge pride. એટલે Dadaji, what Dadaji said, ke pride or ego, when it gets feed or boost, it swells up. Oh, nice. When it gets hurt or not boosted, then it gets shrunken. So that discharge ego, and especially with the name and name-bearing effects, I can see that.
Okay, one more thing, definitely in your long professional life, career, you would have come across some failure somewhere.
Yes,
that might have very badly hurt your feeling, maybe hurt your pride. Can you relate that?
Failures in which sense are you referring?
Patient.
Yes. So results wise.
Result wise, yeah.
Yes. Number one, as a surgeon, ophthalmic surgeon, we have many instances which slaps our ego and keeps it at the ground level only. 3 case nice, 4th case some here and there, and nature slaps your ego. So we ophthalmologists, even amongst ourselves, we discuss that mostly we are kept humble by nature.
I see. You're fortunate that your profession itself keep you humble.
Yes.
Doesn't allow you to boost your ego.
Upright, there is one slap. Something here and there going in some patient, and I come to the ground. So this is one thing. So second thing, patient comes to know later on. I come to know first that there is something which has gone wrong despite all my efforts, or there is a problem. So that night is a sleepless night for Shailesh. Despite all Shuddhatma, all Dada, all everything, at the relative level, that night is a sleepless night. Whenever there is any complication into any patient, be it Shailesh's mistake or not mistake. And there is a dictum in us that one who says I don't have complication is not operating at all. One who is operating will have complications. That's a dictum. And there's a huge book of complications with any greatest surgeon of the world. And we have these sessions where one openly confesses what I could not have done or what I could have done better. So these are the natural things in my profession, which keeps my ego at the ground level, or which beats my pride at the natural level. And second thing, nowadays, patients also become upfront with us. Because
How is that?
How is that?
I mean, how do they do that? I would say that.
Patient feels that his result is not to the mark. Patient feels that doctor has looted me or taken more money, and they become aggressive with us. They become confrontational with us. We have to forcibly tell our relative self, put eyes on your head, be in Gnan, be professionally also Shuddhatma. Otherwise, nowadays people beat the doctors also in India. So,
Oh,
Ah,
they are Google experts,
so
right?
no,
They are Google
physical
experts.
Rajani Bhai, there are instances of our fellow friends who are beaten by the mob. So
Oh, really?
we have to have the groups formed, that the emergency groups, if somebody has a problem, the emergency group is rang up and the other people have to come to his or her rescue.
Oh,
So this is the situation. So, so there is no space for our pride to get inflated,
blow up, huh? Inflate.
to
I
blow up
see.
in the present day practice. So
Right.
sometimes the patient gets confrontational, sometimes, and patients are patients, and they have their own levels. So, but yes, with Dada's Gnan, after a while, we come all right. And even if sometimes Prakriti has reacted, I can feel separate, or I can immediately say, Shailesh bhai, you have lost your command, come back.
Right, right. Dr. Lalita Ben, are you there?
yeah, she was there.
No, she's
Yeah.
there.
Yeah,
Yeah. Can you
Yes.
share your experience in this regard where you came across failures and you had nightmares? Maybe.
Oh, plenty. Lawsuits. This is a
My,
litigious
my
society.
God.
And my profession is one of the highest sued
Risk.
professions for bad outcomes.
Yes.
And so, yes, I have had that. And the legal language that comes out makes you feel like you could crawl under the earth. They make you feel like you're the worst kind of human walking this earth. The kind of language that the lawyers throw at you. And, the lawyers all look at it as just courtroom drama or whatever. But the first time that happened, I was crushed, totally crushed, because this was a bad outcome with a dead baby, and the mother came late, and the diagnosis was made when she came in. We had a dead baby, but she felt like we should have done something earlier. And, it ended up in a lawsuit, and that was my first time in this profession. That was 1 year before I met Dada. And
Then how many years of practice was then?
Huh?
How many years of practice was then?
About 2 or 3 years, 2 years.
That's it.
Yeah.
That
I
means
met
it's
Dada
quite
in
early.
82 and I started practice in 79. Anyway, it happened to be settled, but before that, not knowing my true self, this kind of barrage of legal words, I thought like I should just hang it all up, quit my practice.
Yes,
Go
Doctor.
ahead.
Shaileshanandji.
I can see pride, and I have to sort of, with Gnan or with whatever, I have to control it, because the other people will have the weapons of their Kashais. They will throw more everything at you, ego, pride. They will speak the language of Kashais. And you have to refrain from using your Kashais. So that's the moment which is the most
Challenging part.
requiring moment, or most challenging part.
Right.
Because others leave aside appropriately or inappropriately, but throwing all the weapons at you.
Conveniently.
Using weapons of Kashay. And
Just
you
trying
are
to.
not allowed to use the weapons of Kashay.
No.
Because Dadaji taught us that he never
I mean, do
replied.
you have any kind of ethics in this regard in your field?
Sorry?
Such as?
Any kind of ethics which doesn't allow you to do this?
I don't understand. I mean,
No, in the sense like how you have certain things as a professional, as a doctor, medical doctor, you have some ethics which you have to follow, and that's it. You cannot cross. People can do anything.
Ethics.
Correct. We
Yes.
do. We can't, everything has to be done. If you have a lawsuit, it has to be answered legally. You cannot go and beat up the person or hire gundas to beat up the person.
See,
It's
there
all
are two
legal.
types of ethics, Deepakanandji. One is the professional ethics of treating the people. One is the behavioral ethics. So people can do whatever but you can't do.
Yes.
You
yes.
can't cross the line of professional dignity. And I tried to learn not only from Gnan, but I tried to learn from few of my friends who remain so quiet.
Mhm.
Leave aside Gnan, but they are better off than me. So I see that and I try to incorporate that. Sometimes my Prakriti may get little short-tempered. Not.
But did you inquire any time? Did you inquire any time what made them so cool?
Yes, I sit with them. I see with them. See, there are two aspects of the story. One is they have taken it more professionally, or they have understood the professional attitudes better, or to remain professional. The means a little superficial or little detached as a professional. And another thing is they have their inbuilt Prakriti qualities also sometimes. So but I consciously see those type of things.
Naturally gifted qualities.
And I compare with my Prakriti and then tell the inside that, oh, you need to be still more quieter like them.
Correct.
Quieter and smiling, whatever the people
Right.
do. So there, see, this is when the other people have right to use Kashais with you while dealing with you. You don't have rights to use Kashais in dealing with them.
Correct.
And as you were saying, your behavior should be such that their Kasais also get quietened down.
Yeah,
I heard your sentence.
Yeah,
As Mahatma, your dealing should be such that their Kasais
should subside. Yes, they should subside. You cannot be an instrument to
provoke that,
instigate or provoke their Kasai. Absolutely.
No.
I just wanted to share one example. One medical doctor who had recently passed, and came out and started practicing. First patient died on the OT, operation theater. Operation table, they say. And she was so much carried away by the situation. In fact, she went into depression, and for years together, she could not come out. Finally, she did some, pharmaceutical assistant, this thing. And being a medical doctor, she was working in pharmacy dispensing,
Sir, Deepakanandji, recently one gynecologist committed suicide.
Oh.
There was no fault of hers, but the mob was so aggressive. It was politically motivated and backed up. The lady was so disturbed, she hanged herself up, leaving the husband and children. So our profession has many challenges nowadays.
Right.
Anyway, we were talking about the pride. So this is where you can observe the pride. And despite all the Gnan, the discharge pride has not gone away. Mahatmas has to be watchful. It just is combined with the discharge ego, I would say. And you will realize it more when somebody is hurting it, somebody is insulting, or somebody is undermining it. Then it will come up, why you are not considering me? Otherwise, when there is goody, it will be underground. No need
to everything
show pride. But when it is thrown challenged, pride will come up. Oh, I'm still there.
Someone should get onto your nerves, that's it. How about you, Dr. Lalitaben?
Yes.
Did any time you came across anyone getting to your nerves like that?
Well, with We have a lot of patients who come with Dr. Google and you have to sit and answer all those questions, you know. And I have to say that if you want me to take care of you, we have to put Google aside. Sure, it's good to go get your questions answered. I'm sorry, my dog is barking.
That's okay.
But
He wants attention.
no, she's barking at something going on the street.
Okay.
Yeah, so it's a constant problem. I'm fully retired now, and I'm thankful because it's a litigious society for doctors. If you have a
Yes.
bad outcome, they're just going to take you to court. You can rest assured you're going to have a lawsuit filed. Obstetrics is high risk and neurosurgery is high risk of all the medical professions.
Mhm.
And so I'm glad I'm out of that now.
I'm
But
waiting
I
for
have
that.
one experience to share
Doctor
with
is waiting
you.
for that. We are also waiting for that.
Go ahead
Yeah,
with your experience.
the last lawsuit we had was my partner and me. We had done some surgery on a patient. There was a complication, and we called the general surgeon. He took care of it. But for some reason, she had a rough post-op course. And I went to see her and I prayed for her, did 3 mantra for her and put little ash, Sai Baba's ash on her forehead. Well, anyway, she had a very rough post-op course and she sued. And
Mhm.
she recovered, but she sued, and I did Pratikraman to her, Shuddhatma. I did Pratikraman to the lawyer who slung all the mud at us.
Huh.
And do you believe the case went to court and they found my partner was the defendant. They found the case for him and she got nothing, not a dime. And to
Oh.
me, that is Dada's grace. Because 6 months before the case, her lawyer who did all the mudslinging, he got disbarred from the state. I mean, it was like a soap opera. And I was just seeing things were just falling away. And finally, when it went to court, the jury found in favor of the doctor, and they said the patient didn't have a case.
Oh.
So this to me is the power of Dada, and I quit my business after that.
Oh, so that happened very recently.
Yes, it happened in 2019.
Oh, that means just before Corona, or during the time of Corona.
Mhm.
So we can say this pride thing also simple, but it is quite complicated and delicate. I would say that dealing with your own self and dealing with others, you have to really mindfully manage very carefully and see that others are not hurt. That's very good. Jai Sachidanand.
Jai Satya, very good. Thank you, Lalita Ben, for participating. And our time is up. So, Shaileshanandji, please do 3 mantras. Lalita Ben, please follow.
Okay.
Namo Vitragaya.
Namo Vitragaya.
Namo Rihantanam.
Namo